Can everyone hear me? It was a bit hard for us to hear down there, so I wasn't sure if you could hear as well. Before I start, could I ask for people to put their hands up so we can sort of see who's in the audience today? How many people are from social care, from local authority? Wonderful. Health? No health. And care providers? Wonderful. That's really helpful. Thank you. Let me make sure I can get this to work. What we wanted to do today was really talk about some work that we're doing across the country, supporting local authorities, but also in the main supporting self-funders. So this is people that are responsible for paying for their own care because they have over the threshold of £23,250. I really want to start by sort of setting the scene a little bit, and I've called this the shocking facts because you'll probably be familiar with a lot of these figures. These sort of figures are coming out constantly in terms of how the shift in the demographics is changing in this country. But this has a huge pressure on us as a country, but in particular the health and social care budgets, because we do have an ageing population and it's going to be growing very quickly over the next couple of years. Now, the thing about this is that we should all be very happy and we should congratulate this because we are living longer, but it's the pressure on budgets that's facing agencies in health and in social care. But it's also the pressure on the individuals and for particularly self-funders, those people that have to pay for their own care. One of the things about long-term care, and I'm sure you've all come across this in your work, is that there is still a great deal of confusion by the public over what they are entitled to. If I got a quid for every time that someone down the pub has said to me, I don't have to pay for my long-term care, I've paid my national insurance, I was promised cradle to grave, I would be very rich. And I think there's still that myth that all care is free. So there's often this rude awakening when someone requires social care and they suddenly find out, I've got to pay for it myself. A couple of facts on self-funders, and apologies if I'm sort of teaching some of you to suck eggs, but I think, again, it puts everything into context that Paul and I are going to be talking about. Self-funders actually make up a significant proportion of people who are in residential and nursing homes paying for their own care. 43% nationally, 100% self-funding. But if you add in those that are paying a third-party top-up, it's 57% of people in these care homes. But what we know from reports and research is that very few of these people that are self-funding their own care are actually accessing proper information and advice so they can make informed decisions about their care. In 2009, only 7,000 people actually went on to get the right type of specialist care fees advice that they needed. So that's out of the 170-odd thousand people that are in care paying for themselves. Now, that's not even including people that are paying for their own domiciliary care at home, which is around about estimated to be 271,000. Now, the implications of people not getting the right type of information and advice can be quite significant, and my following slides will show some of the implications for the state, for the agencies, but also the individual. But it is estimated that up to 25% of people funding their own care go on to run out of money. So they run their money down to the 23,250 threshold. Now, this it's very noisy, isn't it? This creates significant cost pressures because when someone's run out of money, whose door do they knock on? The local authorities. At Partnership, we're estimating this is costing local authorities £1 billion a year. In Nottinghamshire alone, it's costing £8.1 million a year to pay for people that used to fund their own care. So this is people that have run out of money. Self-funders do tend also to live, on average, longer in residential care homes. And the reason for that is because they haven't sought the right information and advice. And I'm sure, again, many of you, if you're of a social work background, you've seen people in resi and nursing homes who actually don't have resi or nursing needs because they're outside of the system. They haven't had a care needs assessment, and uninformed decisions are actually being made. Self-funders, because there isn't a clear pathway for them, tend to do what Buckinghamshire County Council, the drunken walk. They don't know who to talk to, who to go to, and so they bounce around trying to find whatever information they can. Now, some do go to the council, But they may be fortunate enough to maybe approach a council like Nottinghamshire County Council to get access to information advice, or they might be told, and this might be a story some of you are familiar with, as a self-funder, what I'll do is I'll send you a copy of the care directory, pick a care home. When you've run out of money, give us a call and we'll come out and assess you. That's not helpful for anyone, so that's what we want to talk about today. The consequences of self-funders not getting access to the right type of advice or at the right time can be quite dire, as I mentioned earlier. You've got people going down inappropriate care pathways, so mum's maybe in a resi home where she wasn't aware of other options, other opportunities, maybe staying at home with a live-in care or even extra care. Inheritance is a big part of also for individuals. We have a generation now who has something to leave behind, but money can run out pretty quickly. So someone who's maybe decided to sell their property and has quite a considerable amount of money, that money could run out quite quickly for them, so there's nothing left for their loved ones. One of the other issues I think is for you as care providers, and again some of you may be familiar with this, is when someone does run out of money, sometimes it's that difficult conversation between yourself and the local authority that actually what that individual was paying is higher than the rate that the local authority will pay. So that tricky decision is then made. Do you keep them in your home and reduce your fee down to the local authority rate, or is that person asked to leave the home, or is the family having to make a third-party top-up? So what we're seeking to do here is turn this all completely on its head and ensure that there is a clear pathway for self-funders so they know where to go. If you're a state funder, there's a very clear pathway. If you're a self-funder, that pathway doesn't exist at the moment. And that's about doing three things: raising awareness, process, and engagement. And by that, what we mean is all agencies, public and private, working together in an integrated approach to actually support those individuals in that position. So we're talking local authority, the NHS, the voluntary sector, the care providers. You're all people that are engaging with these individuals who are in this situation and helping them to access that information and advice. That will then allow them to look at solutions. And so that may be financial solutions, that might be looking at their affairs, that might be looking at the types of care that's available for them so they can think beyond maybe just a care home and explore those other options. So what is the best practice approach? Well, Paul's going to talk to you in detail about what they've done up in Nottinghamshire, but the best practice approach is not what I call a bloody leaflet. Leaflets will not change the world. This is about engagement and discussion, and that's where we talked about awareness, process, and engagement. And it's about helping those individuals and their families to guide them through to the places that they need to talk to. So it's about having clear and robust processes in place. That's absolutely key here. Because what we want to move away from is the let me send you a copy of the care directory, when you run out of money, give me a call, because actually that's not helping anyone. What we need to move away as well is from my advice is to get advice. That's not very helpful either, and we will challenge that, won't we, Paul, in terms of that is not helping that individual, and it's certainly not helping the local authority or even the health service. So it's about having a conversation with these people in the way that you normally do to help them understand how they can get to proper information and advice. I'm going to pass you over to Paul now, and Paul's going to talk to you about what they've been doing up in Nottinghamshire to really plug this gap, which unfortunately does exist across the country. So I shall talk to you in a second.
Thank you. Okay, good afternoon. That works. Thanks very much. So my name is Paul McKay, Service Director at Nottinghamshire County Council, and I lead on a number of things, particularly personalisation, and I've done a lot of work on people that self-fund. As Naomi's illustrated, previously Nottinghamshire was like any other local authority. If somebody contacted us and said that they were a self-funder, or they had over £23,000, then what we would do is turn around and say thank you very much and goodbye. But what that's done over the number of years is, because people's savings fall back onto the local authority, it's an £8.1 million cost to us. £8.1 million, which I believe at least sort of £2 million to £3 million we could actually invest in other things by keeping people into the community. It's money we don't need to spend. And so what we started to do was look at how we can actually provide a better service to people that self-fund. Unfortunately, there is no silver bullet, and one size doesn't fit all. So what we looked at is 4 different ways that we can actually provide better outcomes for people. So the first one was actually to look at our web. So the information that we were providing to people through our own internet website, and to make sure that people from there could actually go through to the Paying for Care website and to speak to an advisor to get some information. So if people we know that surfed the net wanted information, we looked at our processes through the internet to actually make that better. The other thing that we looked at was what we called our customer services centre. So again, previously, if people had phoned up, we'd have just sent them a booklet. People don't want that. People also don't understand the language of a self-funder. I think it's something that the local authorities developed. If you talk to your own parents or a relative and ask them, what do you understand by the concept of self-funding? People, I don't think, understand that language. My mum certainly doesn't. So again, what we did was what Naomi's described there as looking at processes. So when somebody phones up and they're looking for information, they're looking for advice, we actually pass the person on to the Paying for Care. Paying for Care being a not-for-profit organisation that can give people impartial advice about options around paying for care. People can opt out, but surprisingly, nobody has actually opted out. Everybody has gone through to actually speak to an advisor. As a result, we've seen a marked increase in the number of people that are actually looking to take advice. Nationally, the average is around about 7–8% of self-funders that take advice. Ours was much the same. Through the work that we've been doing, we're now up to around 25% of people that are actually actively taking advice before they actually make a decision about self-funding in a care home. So the next blocks I wanted to talk about was the care homes. There's a number of care homes here now. You're the best people to make a decision when somebody actually knocks on your door and says that they are a self-funder and they want to buy a place in your care home. You're in a brilliant position then to actually go back to the local authority and ask for a community care assessment, but also encourage that individual to take some advice about the options for paying for care. We know that care homes owners tend to charge more to self-funders than what the local authorities will pay. You also run the risk, if you don't take that advice or that person doesn't take up that advice, is that the local authority, when the person's actually money runs out, will pay at a lower rate, or in some cases, and given the financial pressures that local authorities are under, more and more will turn around and say the person isn't eligible for care. And you're going to be losing income if you don't actually encourage people to actually take out some advice and a plan so they can continue to self-fund, so they don't have to fall on the responsibility of the local authority. And the other area is around this awareness training. We've found that for a variety of things that local authorities do, we can actually provide information to people perhaps before they're thinking about self-funding or through their relatives. So they're just a couple of examples that we've done. GP surgeries is key. I know there's nobody in here from health, but GP surgeries are key. We've also done some talks on radios. Naomi and I were speaking on BBC Nottingham fairly recently. They actually extended the show because of the amount of calls that were actually coming through to probably talk to Naomi rather than me, but to talk to us about advice. We've done things through parks and leisure. We know people will go to our parks. Nottingham is renowned for Sherwood Forest, home of Robin Hood. Has 1 million+ visitors that go through that. That's 1 million people that we can provide information to. So it goes back to this thing in terms of not one size fits all. And the final area that we've looked at is something called the bed solution. It's an electronic system. It's very, very simple. It's a little bit like using Facebook. What that does is actually gives us notification as soon as somebody's entered a care home. It triggers an email to the local authority, also for paying for care, so we can contact and make and provide information with the care home's consent to that relative or resident. The other thing it does is provides electronic means of electronic payments. So when we've implemented this, we're now able to make back office savings through actually doing electronic care payments, which is the first time Nottinghamshire have been able to do that. This has been very, very popular and very well received by care homes, and it's something that other local authorities are actually purchasing. Derby City have purchased it already, and a number of other authorities have expressed an interest in that as well. And again, through the bed system, people can actually have information and advice about paying for care. So hopefully, in Nottinghamshire, we're covering our bases, and I think we're already on course to make £1 million worth of savings. So if there are any other local authorities in here that would like more information, I'm quite happy to do that and provide that. We've taken this through 2 administrations, a Conservative administration and a Labour administration. It's got cross-party support, and the politicians feel that it's a bit of a no-brainer because it doesn't actually cut services, but it actually makes savings and provides better outcomes. So a bit of a whistle-stop tour of what we've done. So what Naomi and I would like to do now is just open it up for questions. But if you can direct them to Naomi rather than me. I think that's it.
I think if I can just flip back to the original title of the presentation today, it's about not waiting for legislation change. Now, when we pulled this presentation together, we didn't know about the care bill. We thought it may be coming through. Now, obviously, there's going to be a Care Act. It could be in place by this time next year, which puts a statutory duty on local authorities to provide an advice service, just like Nottinghamshire have done. But that could be 1 or 2 years away. So our challenge out to the community, to what we call the care community, is actually you don't need to wait for legislation to do this. You can actually do this now. Absolutely. And this is actually a very, very simple process. So if we go back to one of my slides there, this is basically you as staff, you as healthcare professionals, social professionals, having a conversation and helping that customer/service user/client. So, any questions from anyone, if we can see you? We've got a shy bunch. No? Yes?
Not so much a question, but more maybe a bit of defensiveness, that as a care home provider, if we didn't have self-funders topping up our income from the lack of funding from the local authority to cover the basic costs, then we wouldn't be able to operate.
Yeah.
So it's a bit of a deception to inform self-funders that they may be subsidising others in the home. It's a reality in every home.
Do you want to answer that, and I'll add to it in a second?
Just as a quick response, I think it does vary from local authorities to local authorities in terms of the difference between what self-funders pay and what the local authority pays. But I am aware that in some authorities it's a marked difference. And I think, again, that stresses the importance of actually, for those people that do self-fund, for you as a care home owner, to make sure that they're getting the right advice and information. Because if they don't get that and they fall down to the 23,250 limit, then I don't know what the policy is in your own authority, but for a number of authorities, it will be just to pay the local authority rate.
Well, the comment I was making relates to, we work with 11 different authorities, so I won't be specific, but one authority in a providers meeting was very clear that they were happy for us to have a wing of rooms in a care home that was for local authority residents that was just good enough, and then a wing for self-funders that was covering the true cost, which is contrary to our ethos completely. But that's the attitude of some authorities. That's reality, I'm afraid, if it's awkward.
Okay, again, difficult for me, obviously, to comment to a certain extent on that. Certainly that's not the case in Nottinghamshire. We would expect whether it's a self-fund or the local authority placed person, that they receive the same standard of care. I think that's important. Perhaps you and I could speak afterwards, because I'll be quite interested from a local authority perspective about that. But no, this is around making sure that people get good advice and information about paying for care, because too often, as I say, only 7% of people on average actually take advice. So, and it's arguably one of the biggest decisions that a lot of older people will make after their mortgage.
Can I ask, is there anyone in the room at the moment that who interacts with self-funds, so people paying for their own care, actually helps or refers them on to get information, advice, and in particular financial advice, which is the crucial bit that's often missing? Does anyone do that at the moment? Would you care to share with us what you do?
Hello, I'm from Guildcare, a provider down on the south coast in Worthing. We have some talks organised from time to time with a financial advisor. We also have literature within our homes, and we do encourage people to have a look at this before they make that decision.
Fabulous.
Absolutely.
It's exactly where we're trying to get to in terms of the messaging, because I think it's all different agencies have a part to play with this, because I'm sure you've come across individuals who have not gone anywhere near the council because they don't make that connection that they maybe need to talk to the council because they're there for street lighting, bin collections and council tax. You know, people don't think of the council always in that way. So that is absolutely superb. Okay. Any more questions? No? Do you have a final comment before we wrap up?
Yeah. I'll just ask
Yeah.
one question, if that's all
Do you
right. Does Nottinghamshire, the only people that you turn to or ask people to go to for advice would be partnership? Have you got a direct relationship with them?
Paying for care.
Oh, sorry.
Yeah. The question I've been asked in terms of in Nottinghamshire, is Paying for Care the only organisation that we working with? The simple answer to that is yes. We've taken it through council support to get approval that we would actually have a working relationship, a partnership with Paying for Care to actually provide that information and advice. That doesn't mean or preclude people from going elsewhere, but as a not-for-profit organisation, we feel that they give advice. They're not selling the financial product, which again is important to us. And it creates what I call an air gap between the local authority and the financial advisor. So yes, and it works very, very well.
Right, that's lovely. Thank you very much. Are there any more questions from anybody? Because I find this topic really interesting, and I'm sure there must be more questions out there.
Oh, lady at the back.
This is going to keep George fit. No wonder he's so slim.
Is Paying for Care a national organisation, or are they just in certain parts of the country like Notts?
Paying for Care is a national organisation. With local authorities, it operates in a couple of ways. It's got a free telephone information advice service, and there's also a website as well, so people can access via different mediums there. But it's national. It is a national service, absolutely.
The other thing which is important for Nottinghamshire, just in terms of that, a couple of things, is that firstly the financial advisors that Paying for Care will use are actually paid on a fixed payment. That was important to us. So there's no incentive for financial advisors who are working on commission-based products to actually sell the most expensive products. What we found is by working again with people that are on fixed commission-based products, they will actually provide the best solution for that individual, and that was a key thing. The other thing which Naomi hasn't spoke about in detail, which she also liked about the Paying for Care, was you can actually speak to an advisor over the web, a little bit like if you're booking a holiday, you can speak to a virtual person. They come up and ask you, what sort of requirements you've got. Again, you can have that live chat with people over the web. And it also has a facility where if an advisor actually isn't available at that time, you can book a time for somebody to contact you at a more convenient hour, etc.
If anyone would like to talk to anyone from Paying for Care, my colleague Kate is here today, and the Paying for Care stand, spookily enough, is right outside this door. So if anyone would like to have a chat with Kate, please do that. Yes.
Can I just say I agree with that. We do need a fixed price, and that's what we do at Guildcare as well.
Yeah.
So and that stops a lot of problems.
Absolutely.
Yeah. Okay.
Right. Okay, thank you very much for coming. We hope you found it of interest. If anyone wants to have a private conversation with either myself or Paul, we can hang around for a short while, or we can meet you just outside.
Thank you very much.
Thank you.